So I'm going to kick off the session with the next talk, which is, I'm pleased to say, is sponsored by AstraZeneca. The session is entitled, or the talk is entitled, The Psychological Impact of Diagnosis. I'm very happy to introduce Professor Juan Valle and Andy Clay, who also gave an excellent talk yesterday. Over to you guys.
Thank you very much indeed. And I'd like to thank AstraZeneca for allowing us to have a discussion around the psychological impact of diagnosis. For those of you who don't know me and maybe online, I'm an academic medical oncologist currently working as the Chief Medical Officer of the Cholangiocarcinoma Foundation in the US. I'm quickly going to ask Andy just to introduce himself, and then I'll tell you a bit more about this session.
Thank you, my name's Andy Clay. I've been a cholangiocarcinoma patient now for the last 6 years.
So I'm going to start probing a little bit more about Andy's story, but just to let you know that we want this to be interactive. So there are stand-up microphones in the room. If you want to put your questions on the online platform, it'll also come through to me. And we've got 15 minutes to have this discussion. So maybe to kick us off, Andy, if you can just give us a little potted history. I know you spoke yesterday and gave us the full story, but if you just give us a quick potted history, and then I'm allowed, I think, to just interrupt, if you don't mind, every now and then, just maybe to pick up on some threads that we need to discuss.
No, sure, absolutely. As mentioned yesterday, the brief version is I had jaundice in January 2018. Went to see the GP. He told me that I'd got a blocked bile duct, sent me to a GI. They did an ERCP to insert a stent to release the bile, and that procedure, as we heard this morning, gave me pancreatitis, put me in hospital for 3 weeks. I developed a pseudocyst. That delayed any further diagnosis because the pancreatitis clouds MRIs and CT scans. I had the necrotic tissue removed right up until June, when I had my Whipple surgery. We still had no confirmation other than a brushing, scraping that they'd done during our ERCP. And I had the Whipple surgery. That was reasonably successful. There were some nodes invaded, so I went on capecitabine for 6 months.
Could I just jump in there?
Yes.
At what point were you told that you had a cancer diagnosis?
Right at the beginning, even the GP had said it's going to be either a cyst, a gallstone, or potentially cancerous. It wasn't really until I actually got the histology back from the Whipple operation that it was confirmed it was cancer. Up to that point, I consider myself a fairly optimistic person, almost to the point of blind deniability, and I really hoping against hope all the way along that it wasn't actually cancer.
And when you found out it was cancer, tell me how you felt.
I'd already lost my mother my father and sister had already passed away from different cancers. My mother had already been diagnosed with terminal cancer, and it was my turn. A lot of time in hospital bed recovering from the operation. I started having a lot of thoughts, very, very negative thoughts around what have I done to deserve this, why me? And this kept spiraling down very rapidly. I became obsessed, thinking about everything that had gone on in my life, and that this was karma. I'd done something dreadful to somebody, and it was coming back. This was my punishment. And that was probably the first time it started to set in that I was really ill.
And where did you get your support from at that time?
Nowhere really to be seen. I did try and talk to doctors and nurses about the way I felt. I was having these dreadful nightmares as well. It was generally dismissed. The saviour, I had an inner voice that just said to me, listen, even if you find out why you've got this, what difference is it going to make? Unless you've got a time machine to go back and fix whatever the problem was, you can't do anything. This is just a complete exercise in futility. Pull yourself together and get yourself well and stop feeling sorry for yourself. Sounded like my dad. But that was a very clear moment when I started to, the self-pity stopped, and I started to focus more on the positive aspects of getting well.
And the story then, once you knew about the cancer, you were advised to have some adjuvant chemotherapy, which you then had.
Yeah.
And you then told us that as you were getting to the end of your chemotherapy and had a reassessment, you had a backward step. Just tell us about that.
That's right. So I was getting quite bullish because it had been a reasonably successful, clear margins, low invasion, and I was feeling pretty good about how things were going. We did a PET scan and a CT scan to accompany that, and went to see the oncologist, and he showed me on the screen, and I looked like a Christmas tree. There were just red lights everywhere, and he was talking through all the different areas where it had reoccurred. My wife said to him, "What does all this mean?" And he said, 2 to 4 months.
So you've had the downs, you've kind of recovered from that, and then how was your mood at that point?
That was absolutely devastating, in so much as I'd sort of already recovered. I thought I'd recovered mentally, and I was really feeling very good about myself, and I was expecting a clean bill of health. And because I didn't feel bad, and that was one of the downfalls, I suppose, was because I was feeling okay. I assumed I was okay, and that absolutely floored me. Not only was it devastating to take on board, but also then to have to tell my children, tell my friends, family. It was, and as I was told, some of them just burst into tears. Some of them I never heard from again. Varied reactions, and but I still carried on going to work, and again, denial came in a bit, and I thought, well, if I can get my life, if I can still go to work every day, and if life can continue as normal, somehow it'll all disappear, and it'll just be a bad dream, and I'll be okay.
And again, did you feel you were having to pull yourself up by your bootstrings, as it were, or did you get access to any help and support?
No, I didn't get any access to help and support. I wanted to be strong for my wife and for my kids. I didn't want them to see how I was suffering in case it had an adverse impact. They were already upset enough. So I just persevered. Doug, it's amazing what the human spirit can do when you're down in the dumps. You can find strength that you never knew existed. And get yourself back on the feet, and at least pretend that you're doing pretty well.
So you're looking pretty well now. I know you went on to have some treatment, and you had very good results from those treatments. How was your mental health during that time?
I basically hunkered down and just started taking quite literally each day as it comes. I wouldn't think about the future. I wouldn't worry about what ifs. I'm a very sort of practical person. Whenever my wife was saying to me, well, you know, what happens if you have a relapse? What happens if it comes back again? What happens if this happens? And I just kept saying, I'll cross that bridge when I come to it. Let's worry about it tomorrow, but today I'm going to enjoy the day. The weather's nice. Let's take the dogs for a walk. Let's do something else. And I just literally focused on the 24 hours in front of me and didn't worry about what was down the road. Took my mind off it completely. I basically packed it up into a box, stuck it somewhere in the back of my brain, and left it there.
So there's a question here online. Did you have a specialist nurse that you could talk to?
No, I didn't. I was advised to go and speak to Macmillan and said that they had some great people. I felt that as Macmillan's a charity, and there was probably people far more in need than me, that I didn't want to stretch an already underwater organisation. So no, I didn't. And I, you know, in retrospect, I probably should, but it wasn't on the agenda.
one of the things that I think you're going through at the moment is kind of routine monitoring, having scans from time to time. And I've heard patients mention to me before this concept of scanxiety, you know, the worry leading up to the scan, the worry of waiting for the results. Tell us a little bit about how that is for patients.
It's every time I'm coming up to the scans, probably 2 to 3 weeks beforehand, I start getting aching pains around the liver area. And it happens, it's almost like clockwork. It just starts off, there's a lot of scar tissue in there, and I'm sure things move around a bit. But I definitely always feel that something's going to come up on the next scan because I can feel all these things going on. I do monitor my weight, my heart rate, temperature on a daily basis, my blood pressure. So I can see that there's nothing off. And my body does normally react. It's very visible to me when something's not quite right. But it's all these psychosomatic issues going on where I can feel pains and things going on that probably aren't really there. I'm very, very fortunate. I've got an app and a very kind oncologist who lets me look at my reports as soon as they're published, and so by the time we actually sit and have a consultation, I've read through the notes, I know what, and we can, because of that, I can then ask questions around, or if he's going to tell me something, I don't just get fazed by what does all that mean and get blinded by that. So I've actually got time to write down some questions if I've got any and have a more constructive conversation.
No, Andy's also a moderator for the AMMF discussion forum, and I think you mentioned this a couple of times yesterday, that there are psychological themes coming through when you're talking to patients on the forum. I think a couple of things you mentioned were patients are sometimes in a state of despair, sometimes battle weary. Tell us a little bit more about what you're hearing from other patients.
They are I would say the common theme is I've got nowhere else to go. I don't know what to do. My oncologist has told me there's nothing that can be done for either it's me, my mother, my father, my brother, my sister. This is my situation. We've had a terrible journey. This got misdiagnosed. That happened. It took weeks to get this, and now. And we've got nowhere else to go, and please help. That's probably the single commonest theme that we also get.
So knowing your experience and that of other patients, at what points do you think we should be offering or being a bit more proactive about assessing patients' mental health and offering support?
I think two areas in particular I think would be having had the very unpleasant need to give somebody a terminal prognosis, probably not at the time, but as a follow-up is, how are you coping with this? How are you dealing with this? What assistance? I think even just sometimes just talking about, the trouble is with your immediate carers, as I mentioned, they're under enough stress as it is. And having been a carer for my parents, and feeling so hopeless because you can't actually physically do anything to help them other than say kind words. You can't physically do anything to make them better. Carers suffer tremendously as well, but neither of you are talking to each other because as a carer, I don't want to show the patient I'm really upset, and as a patient, I don't want to show my carers that I'm
You're trying
upset.
to protect each other.
And so there's no one, so there's nobody to talk to. And sometimes I would have loved just to have got it off my chest and said, you know, I am desperate, I am terrified, I want to give up. And I don't say all those things because I'm worried about what the repercussions of those within my circle.
And do you think we should have a different support offered for carers and people who are supporting you?
Yes, I definitely. And people, I mean, I was quite fortunate. My children were in their late teens, so were probably better, more able to cope. But I think the whole family really needs some form of assistance. And again, saying sort of, oh, there's Macmillan there. If you want to speak to somebody, doesn't quite cut it. I would much rather see perhaps more like with a dietitian to say, I've made an appointment for you to meet with somebody. They're going to call you, and discuss that. And in the immediate, maybe I don't want to talk to anybody. But I think I'd like to see that avenue pursued more strongly.
And Macmillan, they're of course open for all cancer patients, but do you think we need to be thinking about something specifically in cholangiocarcinoma, given some of the difficulties that we have with the disease?
Definitely, because the one thing that I think cholangio suffers from, differentiates itself from a lot of cancers, is time, which we don't have. And therefore the prognosis is shorter, the ability to be able to do something is shorter, to be able to, and there's all these sort of admin aspects, and I know it's very difficult because there's legal complications as well with your finances. Have you got a will in place? Have you taken care of this? Have you taken care of that? So that at least you can help to organise some of the more practical things which you don't really want to look at all, but are going to make life either very difficult or much simpler if you don't make it.
So we're at time. I'm going to give you the last word, Andy. You've got the platform here, you've got the community. What's the one takeaway you want us to remember from this session? How can we help?
From on the professional side of things, I would love to see more questions, and even in clinical trials that I've been on, there's a lot of ticking boxes, but nobody sort of says to you, how are you coping? How are you dealing with all of this? It's you've been through, whether it's a massive surgery, whether you've been told you're going to die in a couple of weeks or months or a year, some sort of follow-up of how do you cope? How are you coping with all of this? Do you need any other help? Do you need to talk to somebody about this outside of the family? That would be the first thing. And the second thing is, for people who are going through this, don't be like me. Do call somebody, do find some resource somewhere, because even if it's your GP's referral, it's because I don't think anyone would dispute that a patient with a more positive and stronger mental health will generally live longer.
And I think just make sure that you're aware of the resources. We've got clinical nurse specialists. We've obviously got the foundation as well. So I'd like to thank you, Andy, for being so open with us about how your mental health was during your journey. Thank you.
My pleasure. Thank you.
Thank you.